Hello, I'm Dr. Shasthara, Assistant Professor of Neurology, JSS Medical College Hospital, Mysore. Epilepsy, disease known to the mankind since years and years, unfortunately is tagged and plagued by a lot of social stigma. Even now, people fear to talk about epilepsy, they fear to reveal the diagnosis of epilepsy, they also fear to take treatment, and it leads to a lot of morbidity and mortality in our society. 1% of our entire world, that is definitely an understatement, is suffered with epilepsy. Epilepsy in India is extremely rampant, very common. With modern medical aids, the more and more diagnosis being made because of increased awareness among both patients as well as among the doctor fraternity. But still, we have not penetrated deeply into the system of the rural India, and many of the patients are still only what we see is the tip of an iceberg. And many are hidden, many are underdiagnosed, and many are undertreated or mistreated or misdiagnosed. We all know epilepsy is a huge basket of diagnosis for recurrent seizures. It is not one particular disease, it is basically a syndromic diagnosis in some patients, and it has got specific etiology in some more patients. So we need to scientifically see the patient, classify the disease according to the axis of classification, and subclassify them and treat them according to the clinical, electrophysiological and radiological triad of the diagnosis. It is not extremely simple, neither it is not too difficult. It is definitely possible by a qualified doctor in this particular present era, and we can definitely treat them to give a better life. Epilepsy per se needs a scientific way of approach by the doctor's end, as well as needs a lot of patience from the patient's end. So patience and doctor's patience both are extremely important for treatment of epilepsy. A doctor has to be really scientific. He has to be really use his mind and brain to make a diagnosis and to treat the patient accordingly, so that we don't mistreat them or misdiagnose them, because certain types of treatment can be counterproductive and in fact lead to a lot of problems instead of doing good. With the modern era, we have basket of drugs available, array of drugs available in our armamentarium, which can actually treat epilepsy and in fact even cure epilepsy. We have seen patients being cured of epilepsy in many contexts, and they are leading a normal, healthy, happy life thereafter after around 2 to 3 years of management of epilepsy. Pregnant women can be treated, elderly can be treated, children can be treated, irrespective of age group, irrespective of gender, epilepsy is treatable today. So my sincere request is this: let us all be aware of the epilepsy, let us all be aware that it is very much treatable. Only tool is to generate awareness among ourselves as well as among in the public, and to spread the awareness to the people, so that we can have a definitive and a better answer for epilepsy. Let us all join hands together with the doctors, with the fraternity, with the medical people, with the public, so that we can give a better life for all our epileptic patients. Thank you so much.